Bay na po tayo for good morning to our media partners and those watching on DOH social media channels. Welcome to today's Media Forum, Monday, December 20. And before we start our Media Forum, may I call on USEC Maria Rosario Singh Vergere for updates on the department's response to Typhoon Odette and the COVID-19 national situation. Good morning po, USEC.
Yes, good morning, Jolo, and magandang umaga po sa inyong lahat. Welcome to our Monday Speed COVID-19 Media Forum. This past week, the Department of Health has been focused on working closely with our partner local government units in the regions to prepare and respond to possible damages caused by Tropical Cyclone Odette. We are saddened to hear about the loss of lives and damage to properties and livelihood in the hardest hit areas in Visayas and Mindanao. However, despite the blackouts and intermittent power supply for days, many local governments are now successful in protecting their vaccine storage facilities, mobilizing their vaccines to facilities with backup generators. Because of this, our latest report from our National Vaccine Operations Cluster shows that there has been minimal wastage of COVID-19 vaccines due to Typhoon Odette. Mabuhay po lahat ng ating local government units. Maraming salamat po sa ating pagtutulong-tulong. Tayo po ay nakapag-minimize ng mga epekto nitong typhoon sa ating pong mga bakuna. Meanwhile, we will continuously monitor and coordinate with the local governments to fully assess the effects of the typhoon in our regions. We assure our partners that we will work hard to retrieve any lost vaccines. The National Vaccine Operations Cluster will also facilitate the reallocation of vaccines depending on the availability of supplies to ensure that everybody will have access to these life-saving vaccines in the coming months. The DOH also continues to strictly monitor the presence of the Omicron variant in the country. As the global scientific community continues to study the variant, we remain vigilant by strictly following minimum health protocols such as wearing of masks, proper hygiene, proper ventilation, and physical distancing. Vaccination also remains to be the most effective way of protecting ourselves and our loved ones from all variants of COVID-19. Real-world data even show that COVID vaccines are indeed effective in preventing severe infections, hospitalizations, and deaths. Before we proceed with the COVID-19 situationer, allow me to provide some updates first on DOH's response to Typhoon Odette. Can I have my slides, please? Next slide. Based on the report from our Health Emergency and Management Bureau and from DSWD, Typhoon Odette has affected at least 301,412 families from 2,983 barangays in regions 4B, 5, 6, 7, 8, 10, 11, and Caraga as of December 19. Of this, there are at least 103,271 families temporarily sheltered in 2,302 evacuations. To date, there are 7 damaged health facilities from Caraga and Region 7, with estimated cost damage pegged at 8.3 million. These are 3 barangay health stations in Caraga, Madrid District Hospital in Surigao del Sur, Siargao District Hospital in Surigao del Norte, the Provincial DOH Office in Surigao del Norte, and the Center for Health Development 7 compound. Next slide. In preparation for the typhoon, the DOH Central Office has alerted all centers for health development, especially those in the typhoon track, and continuously monitored their situation. Assessments are still ongoing to determine the needs for the regions for resource augmentation. Meanwhile, as of December 19, the DOH CHDs has pre-positioned a total of 11.8 million worth of drugs, medicines, medical supplies, including PPEs and other COVID-19 supplies to its provinces. Moreover, a total of 66.6 million worth of commodities are available at the DOH Central Office Warehouse and over 272 million worth of commodities in our CHDs ready for deployment. Apart from pre-positioning and mobilizing resources to support the response of local health offices, our CHDs are in coordination with the central office for situation updates and possible resource augmentation. CHDs also deployed human resources for health and the members of the health cluster to conduct rapid health assessment and provide support to the ongoing disaster response. Muli pa rin po naming pinapaalala, lalong-lalo na po sa mga pansamantalang nakabakwit sa mga evacuation centers, please continue to practice minimum public health standards, properly wearing your face mask, observe physical distancing of at least 1 meter from people who are not members of your household, observe proper cough and sneezing etiquette, frequent hand washing or sanitizing, and ensuring enough air circulation inside the evacuation centers, among others. We call on our local governments and your respective camp managers to appoint safety officers inside your evacuation centers. Please provide separate areas for the vulnerable population, katulad po ng ating mga nakakatanda at saka yung po may mga comorbidities, and for those who have other illnesses as well. The DOH also warns of waterborne and foodborne illnesses, influenza-like illnesses, leptospirosis, and dengue, or the wild diseases. We can avoid this by promoting access to water, sanitation and hygiene facilities, and resources are safe for drinking and cooking para makaiwas po tayo sa mga sakit gaya ng cholera, typhoid fever, amoebiasis, hepatitis at iba pang sakit na dinudulot ng maruming tubig. Panatilihin po nating malinis lagi ang ating evacuation centers. Huwag din po tayong lulusong agad-agad sa baha, lalo na po kung tayo ay may sugat sa ating mga paa, sa ating mga binti, para maiwasan ang sakit gaya po ng leptospirosis. Let me now provide updates on our Iwas Paputok campaign. First is the fireworks-related injury or FWRI surveillance. The fireworks-related injury surveillance is a year-end activity intended to capture and report fireworks-related injuries. It is an online health information system structured under the ONAIS or the Online National Electronic Injury Surveillance System. WRI is conducted from 6 a.m. of December 21 until 5:59 a.m. of January 6. So sa ngayon po, wala pa ho tayong report. Bukas po mag-uumpisa ang ating regular reporting to the public. But as of to this date, wala pa hong naitatala na mga any type of fireworks injury. So what do we expect from this report? That the surveillance system captures reported FWRI from both the Sentinel hospitals. However, the generated report provides data from the 61 Sentinel hospitals for trend comparison purpose. The DOH provides daily reports on individual injury reports and compares trends to last year and average of recent 5 years. Patuloy na ipagdiwang natin ng masaya at kasi-kasiyang mga Filipino holiday activities sa pamamagitan po ng pagsasagawa ng madali at magagawa nating health. Pigilan po natin ang disgrasya o kaya aksidente sa pagpapaputok sa pamamagitan ng pag-iwas sa paggamit nito at pagiging handa sa lahat na magiging pwedeng aksidente. Sa pamamagitan ng pag-iwas sa paggamit ng paputok at pyrotechnic device, maaari po nating ipagdiwang ang kasiyahan or holidays ng magkasama habang iniiwasan ang unnecessary wastages ng mga resources ng pamilya. Una, gastos sa pagpapagamot dahil sa mga paputok. Pangalawa, oras na igugugol sa pagkuha ng mga serbisyong pangkalusugan dahil kailangan dalhin sa ospital ang mga naputukan. At pangatlo, yung emosyonal na kapital sa mga hindi kanais-nais na epekto ng mga aksidente. So ang bottom line po, iwasan po natin ang mga ganitong klaseng insidente sa pag-iwas po natin sa paggamit ng mga pagpapaputok o yung mga pyrotechnic devices po. Meron po tayong mga sa National Capital Region na nagkikater sa mga biktima ng paputok gaya ng Philippine Orthopedic Hospital. Next slide please. Mga biktima ng paputok gaya ng Philippine Orthopedic Hospital, East Avenue Medical Center, Las Piñas General Hospital and Satellite Trauma Center at ang UPPGH. Alalahanin po natin na mas magiging masaya po ang ating Pasko at bagong taon kung ang bawat miyembro ng ating pamilya ay ligtas sa kahit na anumang sakuna. Proceeding to the latest update on our COVID-19 situationer and biosurveillance efforts. On December 19, next slide please. On December 19, 203 new cases were recorded, bringing the total reported confirmed cases to 2,837,577, of which 0.34% are active cases, 97.87% are recoveries, and 1.79%. Looking more closely at our active cases, 7,549 of these are either asymptomatic, mild, or moderate, while severe and critical cases have gone down to 2,180 cases. The top 5 regions contributing to these new cases are NCR, regions 4A, 6, 7, and 2. And the top 5 areas contributing to these new cases are Negros Oriental, Rizal, Manila, and Cavite. Our epidemic curve shows that the current average daily cases have further decreased by 97 cases or 24% this week and now at 299 cases per day. The current average daily cases have declined to surpass the lowest cases reported after April 2021 and August 2020 peaks. Looking at the epidemic curves of our major island groups and the areas, all areas remain with a flat case trend since the start of December. In the National Capital Region, daily cases have remained to be low, with the recent week showing a decrease of 6 cases or 7% from the previous week. Similar to the national data, the NCR's recent cases per day already 8 times lower than July of 2021, which was at 628 cases per day, and also lower of 2021 cases of 288 per day. Nationally, we remain to be at minimal risk case classification with a negative 2-week growth rate at negative 51% and low risk average daily attack rate at 0.32 cases for every 100,000 individuals. The national health system's capacity is at low risk. All regions are now at minimal risk case classification, showing negative rates and average daily attack rates of less than 1 per 100,000 population. Both total COVID-19 beds and ICU bed utilization at low risk in all areas of the country. The NCR is currently at minimal risk case classification with a negative 2-week growth rate and an average daily attack rate of 0.58 per 100,000 population. The national admissions is on a slow decline. Risk utilization at 18%. Next slide, please. As of December 19, admissions were lower by 9,677 or 60% versus the July 1, 2021 admissions. The current dedicated beds have decreased since the start of October and is only slightly higher by July of 2021. Can we have this there? Next slide, please. ICU admissions have also been on a slow decline and is currently at low risk utilization at 21%. The current ICU admissions are lower by 1,128 or 60% compared to July 1 of this year. Similar to total beds, the current dedicated ICU beds are only slightly higher by 67 or 2% than in July of 2021. Among our confirmed COVID-19 admissions, the percentage contribution of critical cases, which are the red line, shows a slow decline at the start of December, while the percentage contribution of severe cases, the orange line, still with a continuous decline at the end of October. As of December 19, 180 or 19% of 966 total admissions are severe and 74 or 8% are critical cases. We would like to flag 5 areas showing positive growth rates in the recent 1 week and 2 weeks. Iligan City at moderate risk case classification with high risk 2-week growth rate. All areas remain with low risk average daily attack rates and low risk total bed utilization. Based on these metrics, these areas remain to be under alert level number 2. However, please note that the large growth rate reported in these areas may the small baseline numbers of these areas. So for example, in the previous, Olongapo City only had 2 active cases, and now at 25. Iligan City previously had, ilan yung sa Iligan? Iligan City has less than 10 previously, and now we have 40 total active cases. So the 2-week growth rate is affected by the small baseline numbers of these areas. Next. In the current week, all provinces, highly urbanized cities, and independent component cities remain under alert level 2 with minimal to low risk case classification or moderate risk case classification with low risk bed utilization. Looking at our mortality data, the death shows a continuous decline in the weeks following its peak in September. Next slide, please. Partial data for December reports 6 deaths per day on the average. Let us now go to our biosurveillance updates. To start, here are the updates on the Omicron detection globally. As of December 20, there had been 13,672 submissions of genome sequencing to GISAID that are positive with the Omicron variant. The United Kingdom now has the most number of cases submitted to GISAID with 8,622, followed by South Africa, 296 cases, and 98 countries now have reported detections of the variant at present. 40 countries are with confirmed or suspected local transmission. Now, let me provide you with our updates on our whole genome sequencing in the country. As of December 18, of the 19,000, 42.3% of samples were positive. 18.2% of samples were positive for the Beta variant, 15.9 or 3,169 samples were positive for the Alpha variant, 0.02% or 3 samples positive for the Gamma variant, and 0.02% or 3 samples also positive for the Omicron variant. This one case was detected during the most recent run. Next slide. Of the 630 during our most recent whole genome sequencing run, 496 cases or 78.73% were detected with the Delta variant, 1 or 0.16% was detected with the Alpha variant, and there is 1 new case detected with the Omicron variant. Of the 11 returning overseas Filipinos with the Delta variant, 3 had travel histories to USA, 1 each had travel histories to Singapore, Mexico, Malaysia, Jamaica, Colombia, and the UAE, Qatar, and South Korea. The returning overseas Filipino with the Omicron variant arrived from Qatar, but was noted to have had travel history to Egypt. Next slide. The third case of the Omicron is a 36-year-old male, sea-based OFW. He arrived at Mactan, Cebu International Airport from Qatar on November via Qatar Airways with flight number QR924 and was noted to have had travel history to Egypt. The case had his sample collected on December 4 and the result was released on December 5. The case completed his isolation in Cebu before traveling back to Cavite, his hometown, where he immediately self-quarantined at home upon arrival. The case is currently finishing his home quarantine in Cavite to be asymptomatic since his arrival. Last December 19, the case was swabbed and tested negative on repeat RT-PCR. The DOH is already determining the possible close contacts among co-passengers during the flights of this case. The DOH also is verifying the test results and health status of all passengers of this flight if there are other confirmed cases or passengers who became symptomatic after arrival. The DOH is also task group on the management of returning overseas Filipinos to complete the details of the flights of these individuals. And finally, I would like to highlight the following key messages. Next slide, please. National and majority of our regions are at minimal risk case classification with sustained low case trend in the recent week. All provinces, highly urbanized cities, and independent component cities of areas remain to be level 2 with minimal to low risk case classification or moderate risk case classification with low utilization rates. Improving case trend should not entail complacency since the threat of COVID-19 is still present. Please ensure safer celebration of the upcoming festivities. We must continue to mask, distance, and avoid closed, crowded, and close contact settings. With the detection of the Omicron variant in our border, to enhance our preventive measures and ready our borders and local health systems. First, we should have a stronger border surveillance and control. Second, we should remind everybody to regularly and continuously mask, distance, and minimize visits to closed, crowded, and close contact settings. The local governments are encouraged to actively look for cases and clusters and immediately isolate and contact trace and test. Vaccinate, especially those who are at higher risk, like the senior citizens and those with comorbidities. So that is all. Over to you, Jolo.
Maraming salamat po, Yusek, for giving us the latest updates on our Typhoon Odette response and the latest COVID-19 situation. And now let us go to the questions submitted by our media partners. So Yusek, for the first question po, we have several questions regarding vaccine wastage po after death from Caroline Bongkin of CNN Philippines. How did the typhoon affect the pandemic response in the regions? Kumusta ang vaccination at may affected vaccines po ba? Similar question from Iko Miguel of UNTV. May na-receive na po bang reports on vaccine wastage sa mga lugar na tinamaan ng Typhoon Odette? Similar question rin po from Ron Lopez of AFP.
Yes, no. So that question we'd like to clarify. Unang-una, a total of 6 local government units canceled their vaccination activities due to the Typhoon Odette. LGUs in regions 4B, Region 6, 7, and 8, and Caraga have reported 100% cancellation of their vaccination activities due to Typhoon Odette. NCR, CAR, Regions 1, 2, 3, 4A, 5, 9, 10, 11, and 12, and BARM reported no vaccine waste. Thank you po, because alam po natin na talagang pinangalagaan ng ating local governments po ang ating mga bakuna. Meanwhile, the assessment of vaccine wastage for Region 7, 8, and Caraga are still ongoing. Unfortunately, as of December 19, 100 vials of Pfizer vaccines in Region 6, Bingawan, Iloilo Province, was reported to be wasted. The National Vaccine Operations Cluster shall replenish stocks of Region 6 in. So to address possible power interruption of vaccine short storage, the NBOC have previously issued Advisory 49 mandating all Regional Vaccine Operations Center, Local Vaccination Operations Center, implementing units and vaccination sites to closely monitor the temperature of cold chain storage of our vaccines and ensure that the temperature is maintained within the recommended temperature range for areas with power outages and are only backup power sources. So we are closely monitoring these affected local governments. For now, ito pa lang po ang report. Ito pong na 100 vials po ng vaccine, Pfizer, dito sa Region 6 because of power interruptions.
Maraming salamat po, Yusek, for the clarification. For the next question po from Iko Miguel of UNTV, na-verify na po ba ang vehicular accident report sa Calabar Zone to check the condition ng mga vaccines?
Yes, no, we were able to get the report. We have verified. We have already coordinated with our regional office The vehicular accident happened at Lakawan Bridge, Tayabas City, wherein the transport vehicle of PharmaServe Express with Sinovac and Moderna vaccines met this accident. As per the latest report that we got from our vaccine cluster, no vaccines were wasted. 1,960 vials of Sinovac and 240 vaccines are now stored in the Provincial Health Office of Quezon Province. Both of these vaccines were stored and the temperature was maintained at +2 to +8 degrees Celsius. 93 vials of these Moderna vaccines are now stored in General Nakar.
Maraming salamat po, Yusef. The next question is from Ron Lopez po of AFP. First question po, can we still reach our vaccination target this year?
Yes, Ron. No? So, vaccine target ngayon, vaccination target sa buong bansa is 54 million. This is 70% of the 70% target from our population. That equates to 54 million individuals to get vaccinated with 1 dose by the end of November 2021. So that was our first target, yung 1 dose for this 54 million by the end of November. And we were able to achieve that. Actually, as of December 19, 2 million na ang may first doses dito sa ating bansa. With regard to fully vaccinated individuals or those to have their second doses, yun din ang ating target, 54 million should have that. For now, we have 43.5 million individuals already with 2 doses or fully vaccinated. We are still trying to ramp up our vaccination efforts, but of course, we know there are certain challenges that we are facing right now, katulad po nitong typhoon sa ating bansa, na hindi naman po inaasahan, not expected, which has affected our vaccination activities. But nevertheless, itutuloy na po natin ang ating mga pagbabakuna once we are already settled in the different regions which had been affected by this typhoon.
Maraming salamat po, Yusef. Next question is from Rafael Bosano po of ABS-CBN. For his first question, have any of the co-passengers, the 2 patients, the Omicron variant heeded calls of the DOH to contact them or their LGUs? Though Yusek Berhere has said before that the chances for them to import the virus to their communities is low, can the same be said for succeeding batches of incoming travelers, especially as Omicron continues to spread in different countries?
Yes, Rafi, no? So as of to this date, wala pang tumatawag sa any of our hotlines. Local governments also do not have any receipt of any calls from the co-passenger flights with this detection of the Omicron variant or individuals. Pero nakapag-endorse na rin po tayo sa specific regions namin at saka local governments concerned para po meron din silang close monitoring among these different individuals.
Maraming salamat po, Yusef. For the next question of Rafael Bosano, is there anything new about Omicron that we didn't know 2 weeks ago po?
Evidences are still evolving. We had been receiving reports and also evidences posted online na nakikita natin na nag-e-evolve. Unang-una yung tungkol sa bakuna. Manufacturers sinasabi na merong epekto sa isang bakuna. Meron namang isang study na nagpapakita 94 effective against Omicron. Lahat po ng mga datos na lumalabas ngayon, hindi pa ho yan peer-reviewed. Ibig sabihin, hindi pa completed evidence. So we still wait or publish na completed evidences so that we can have more certain guidance kung paano po natin gagawin ito. Pangalawa, may lumalabas din, these recent days, lumalabas yung mga experiences ng iba't ibang bansa ukol sa mga simptomas ng Omicron. And sinasabi nga nila, most of these articles, sinasabi na talagang mild yung mga nangyayari ng mga simptomas. Ang isang article pa even went on to say there is this specific symptom, colds, body malaise, low back pain, at saka loose bowel movement. But again, let me just remind everybody, nagpapaalala po tayo, mga initial evidences po ito. Pwede ho naman gagamitin natin yan to guide us, but we do not need to be fearful, matatakot. Kailangan lang po lagi tayong maingat. And then kailangan din hindi tayo complacent. Hindi porke sinasabi ng ebidensya na mild lang ang mga kasong pwedeng idulot ng Omicron variant ay hindi mag-iingat dahil ang laging sinasabi ng ating mga eksperto, kahit mild lang yan, pero pag malaking portion ng population na naapektuhan, maaari pa rin maka-overwhelm yan ng ating health system.
Maraming salamat po, Yusek. The next question is from Red Mendoza of the Manila Times. For his first question po, ayon sa breakdown na ginawa ng isang consulting firm sa mga cases last Saturday, natuklasan nila na may isang sample galing ng July 2020 at may iba pa pong sample mula August ng taong ito. Ito ay nagdulot ng speculation daw na baka di umano ay may underreporting ang DOH ng mga kaso ng COVID-19. Ano po ang masabi ng DOH dito?
Well read. Unang-una, gusto ko lang sabihin sa ating mga kababayan that the Department of Health has always been transparent with all of the data that we provide the public. Pinopost po namin araw-araw yan kung sakasakaling may mga late inputs tayo na nanggagaling pa sa mga ibang buwan pa, current month natin, nilalagay din po natin yan. Kailangan maintindihan ng ating mga kababayan na ang ating pong datos is heavily reliant on our local governments, our implementing units, our laboratories. So minsan, nagkakaroon po ng mga pagkakadiskubre sa mga local governments natin na meron pala silang hindi naitala o nai-report na kaso noon, hindi natin yan tinatago. Bagkus, kahit na 3 buwan na po ang nakaraan dyan, basta sinumite report pa rin ho natin yan sa publiko. So that is what happened last Saturday kung saan ang pinapertain ng consulting firm na ito ay yung 582 cases natin noong December 17, kung saan meron po tayong isang kaso whose sample collection date was July 31 of 2020. So ito po ay na-verify na po natin at ito nga po ay isang kaso na positibo. Meron po tayo talagang mga delays sometimes in reporting and these are very, very small proportion niya compared dun sa mga naire-report po natin. Katulad po ng sabi natin at sinasabi ko nga, lagi pong transparent ang Department of Health. Wala ho kaming rason para itago ang ating mga numero ng kaso. Amin pong ibinibigay sa ating mga kababayan kung ano ang isinusumite sa atin ng ating mga reporting units. Kung sakasakali pong may mga delay o di kaya ay minsan ay may mga late na reports katulad nitong nangyari nung Sabado, ito po ay dahil nagbabalidate at local governments na meron po silang nakaligtaan o na-miss na mai-report sa amin. Kaya once makuha namin yan, kahit late na, i-report pa rin natin sa public. And that is transparency. Kaya po gusto namin sabihin sa inyo lahat po ng impormasyon ay binibigay natin sa public to appropriately guide ang ating mga kababayan kung ano ang dapat nating gawin, lalong-lalo na't meron po tayong ganitong pandemya na pinakaharap.
Maraming salamat po, Yusek, for the clarification. Question of Fred Mendoza. Does the DOH worry about a possible na explosion of COVID cases and underreported cases dahil sa Typhoon Odette?
Wala. Unang-una, dun sa Typhoon Odette, so naandun lagi ang risk kasi na-displace po ang ating mga kababayan. Nawalan po sila ng mga tirahan, inilagay po natin sila temporarily sa mga shelters. Ito pong mga shelters na to, kaya nga po tayo nagpapaalala sa ating local ay hindi po naman natin ma-maintain ang ating family bubble dito. Magkakasama po ang iba't ibang household. That's why our call for continuous monitoring and of course compliance ng ating mga kababayan. Lagi po tayo mag-mask dyan sa mga evacuation centers. Hanggat maaari, yung pamilya lang po natin dun po sa ating lugar ay manatili tayo doon. Keep the physical distance also and also always wash your hands. So yung risk will always be there, Red, na hindi po natin yan maiaalis. Pero mape-prevent po natin yan kung gagawin po natin ng tama ang ating mga minimum public health standards. Pangalawa, meron din po tayong inaasahan na bakuna na magbibigay ng protection po para sa ating lahat. Now, as to the underreported cases, that is expected right now. Hindi po natin sinasabing underreporting tayo dahil i-verify pa po natin. Pero alam natin that as of the last time that this was reported, around laboratories, 13 non-reporting laboratories nung time, kahapon dahil nga po sa Typhoon Odette. So bine-verify po natin ngayon kung ano po yung mga incidents or yung mga issues natin with our laboratories dito sa mga areas na to para makita natin kung paano natin sila matutulungan. In the coming days, things will slowly normalize at makakakuha na po tayo ng mga actual na kaso natin. Again, let me reiterate, kung hindi man po natin ngayon because of what happened with Typhoon Odette, and it has affected our reporting units and laboratories. Kung ano man po ang papasok na datos na hindi nila na-report because of some issues operationally, ire-report po natin yan in the coming days.
Maraming salamat po, Yusek, for the clarification. And now, we move on po to some of the Zoom chat questions sent by our media partners that we have not yet answered. For the first question po from Sheila Crisostomo of the Philippine Star. Her question po is, what are the factors that are leading to increase in cases in the 5 flagged areas po?
Well, pinag-aaralan pa rin namin ngayon yan, Sheila, no? Dito sa 5 flagged areas, kung ano po yung mga nagiging rason kung bakit merong konting pagtaas. No? Pero babalikan natin, Sheila, katulad ng sabi ko kanina, because of the low baseline na bigla ng 2-week growth rate nila. No? Pero up to now, hindi po yan dapat ika-alarma. Pero pinomonitor internally ng DOH. We are investigating also bakit nadagdagan yung kanilang mga aktibong kaso. So magsasabi po tayo sa public in the coming days.
Maraming salamat po, Yusek. The next question is from Caroline Bongkin po of CNN Philippines. Her question po, ilan po ang identified na close contacts ng third Omicron case?
We were able to identify 3 close contacts from the flight manifest kung saan na-monitor natin, home quarantine sila. We already retested them and all of them turned to be had results of negative.
Maraming salamat po, Yusek. The next question po is from Raul Dancel of the Straits Times. First question po, preliminary lab studies show that Sinovac, Sinopharm, AstraZeneca, Sputnik, and J&J offer near from infection by Omicron. How will this affect our epidemic response? Singapore has stopped giving daily updates on cases as most are mild or asymptomatic. Anyway, and this is instead focusing on hospitalization where cases are likely severe or near death. Is this something that we are looking into?
Yes, Raul. No? So I think you're talking about 2 different things or separate questions. One is about the vaccine efficacy against Omicron and how you report cases. And wherein you stated Singapore is now just reporting severe cases and hospitalizations and deaths. Sasagutin ko yung pangalawa mong tanong na una, yes, the DOH together with the national government is looking into reporting only severe cases, deaths, and hospitalizations in the coming months. But not yet as of now. Because hanggang sa ngayon naman, may mga report tayo, nakikita pa rin natin, marami pa rin tayo mga mild cases, mga asymptomatic, so patuloy pa rin natin pinag-aaralan. But definitely, yan po naman talaga ang direksyon siguro ng bawat bansa, no? Na magkaroon po tayo ng reports na lang as to the severe cases of disinfection and deaths. But for now, we maintain the status quo so that we can continuously learn muna dito po sa mga datos na atin po nakukuha. The first question would be, Raul, very clear on this. As I've said, the data is evolving, no? Yung mga ebidensya. Kung ano man po yung mga lumabas in the previews, apektado, zero na yung epekto ng mga bakuna, lahat po ito ay pauna pa lang ng mga pag-aaral. So kailangan po natin makuha yung kumpleto nating ebidensya para naman magkaroon tayo ng mas supisyente na pagbabasihan kung ano man ang magiging rekomendasyon ng ating mga eksperto at saka anong gagawin ng national government. Sa ngayon, diyan sa mga lumalabas, hindi lang po yan ang lumabas. May lumabas din po, I think that was a day before, 2 days prior, na lumabas din yung sinasabi, yung Sinovac nga, 94% effective, no? Pag nag-booster ka against Omicron. So pag tinignan mo natin yung mga data ngayon na lumalabas, iba-iba ang sinasabi nila. So ang payo ko po sa ating mga kababayan, basta maniwala pa rin tayo sa bakuna dahil hanggang sa ngayon, nakikita po mga eksperto, effective pa rin ang kahit na anong bakunang meron tayo dito sa ating bansa against severe infections, deaths, and hospitalizations. Kung kayo po ay eligible na, magpabakuna na kayo. Kung kayo po ay nakatapos na ng 6 na buwan sa inyong second dose, magpa-booster na po tayo para po tayo ay mas protektado.
Maraming salamat po, Yusek. And that is all the questions we can accommodate for today. So Yusek po, before we close our media forum, May closing message po to our kababayan.
Yes, no? So unang-una, gusto po natin magpasalamat sa ating pong mga media partners, of course. Alam po namin, kasama po namin kayo lagi na sa pagpapakalap ng tamang impormasyon po sa ating mga kababayan. Gusto ko rin hong batiin ang lahat, ang ating mga kababayan, pati po ang ating media partners ng isang maligayang Pasko, malusog na Pasko, ligtas na Pasko at bagong taon po para sa ating lahat. Ligtas, please, Pilipinas. The Typhoon Odette has already left the Philippine area of responsibility, but this should not stop us from thinking that the aftermath is also gone. Let us continue to find ways para matulungan po natin yung mga naapektuhang mga kababayan natin, yung mga naapektuhan po ng mga areas natin dito sa ating bansa. Kasi kailangan po nila ang ating tulong, collective efforts to rise from this ordeal brought about by the typhoon. So sana po natin uli ang ating bayanihan spirit dito po sa Pilipinas kung saan magtutulong-tulungan po tayo para makabangon po yung ating po mga kababayan natin na apektuhan itong Typhoon Odette. Also, we would like to thank our partner local government units for working with our Vaccine Operations Center in preparing their vaccine storage facilities for Typhoon Odette. Dahil po sa inyong partisipasyon, suporta at sa inyong mga effort na most of these life-saving vaccines na kailangan po ng ating bansa. We would like to also thank everybody for the continued support to our vaccination program and minimum health protocols, as this had been proven effective in stopping the spread of COVID-19 and its variants. We have seen much lower cases numbers reaching our target vaccination at least 54 million with 1 dose this year, and we will continue to push for more vaccines the coming months. Again, ito pong mga simpleng sinasabi natin, kahit po makulit na po kami, gusto lang ho naming banggitin uli na meron pa rin hong virus, let us not be complacent. Lagi pa rin po nating aalalahanin, mag-mask po tayo, umiwas po tayo sa mga lugar na matatao, lugar na pangit ang ventilation. Lagi pa rin po tayo mag-uugas ng kamay, isanitize ang kamay. At lagi po, magpakalap lang po tayo ng tamang impormasyon. Again, let me greet everybody and sana po lahat po tayo magtulong-tulong para po sa darating na Kapaskuhan hanggang sa next year patuloy pong bababa ang ating mga kaso. Mag-iingat po tayong lahat. Thank you.
Salamat po, Yusek, and to our media partners. Stay safe po.